Hello, I'm Dr. Geeth Monnapa, Senior Consultant, Obstetrician and Gynecologist, Laparoscopic Surgeon at SPARSH Hospital, Infantry Road. Today, I'd like to talk about the most common sexually transmitted infection in both men and women. So we are talking about the human papillomavirus infection, or the HPV infection. 80% of sexually active men and women would have had some strain of HPV infection by the age of 45. Why are we worried about HPV infections? Although 90% of the times these infections are cleared from the body within 2 years, if the infection persists over a period of time, it can cause cancerous changes in the cells. HPV infection is known to cause about 99% of cervical cancers and a significant number of oropharyngeal cancers, anal, penile cancers, vulval and vaginal cancers. So can we prevent HPV infection? The answer is yes. We do have vaccinations that provide excellent protection from the HPV infection. How does an HPV infection transmit? How does one get an HPV infection? HPV infections are transmitted either through sexual contact or through skin-to-skin contact. Condoms do protect against HPV infections, but because they do not cover the entire genitalia, couples can still get an HPV infection despite using a condom. So protecting yourself with the vaccination is the best way forward. Why is it important to take the vaccination? HPV vaccination is probably the only effective vaccination that can prevent cervical cancer to a large extent. Why is it important to protect yourself from cervical cancer? Cervical cancer is the second most common cancer in Indian women and the fourth leading cancer worldwide. The burden of cervical cancer is still very large in the Indian population. The mortality associated with cervical cancer is as high as 11.2 per 1 lakh women compared to 7 per 1 lakh women worldwide. Indians see about 1,20,000 new cases of cervical cancer every year, and this is a huge burden compared to the rest of the world. We have a long way to go to reduce the burden of cervical cancer. This burden is largely due to seeing large number of cervical cancers in the later stages, like the second and the third stage, where treatment is not as effective. HPV vaccination, in addition to protecting yourself from cervical cancer, offers protection against genital warts, which are caused by low-risk strains of HPV 6 and 11. What is the right age to take the HPV vaccine? The ideal age to take the HPV vaccine is anywhere between 9 to 26 years of age. We recommend that all children between 11 to 15 years of age take the vaccine. Prior to 15 years of age, you require 2 doses of the HPV vaccine. After the age of 15, up until 26 years of age, you need to take 3 doses of the HPV vaccine. The vaccine can also be given after the age of 26 years of age up to 45 years, but this is a shared discussion that you will have with your consultant to know the efficacy of the vaccine. The vaccine is best taken prior to sexual activity, prior to any exposure to HPV infection. Hence, it's better that young children take it prior to the age of 15, prior to any kind of exposure to the infection. As healthcare providers, it is our responsibility to spread awareness amongst people about the HPV vaccine. We do have different kinds of vaccines available in India. We have the quadrivalent vaccine that protects one from 6 and 11 that causes genital warts, and strain 16 and 18 that causes about 70 to 80% of cervical cancers. We also have the nanovalent vaccine, Gardasil 9, that is available in India, that protects you from 7 high-risk strains of the HPV virus that can cause cervical cancers, in addition to protecting you from strains 6 and 11 that cause genital warts. So go ahead and protect yourself and your near and dear ones from the HPV infection and protect them from getting cervical cancer.